Okay, today we're going to go over how to constitute Lumason. So we need three things here. One is the package for the Lumason, and then we use a three-way stopcock here, and then we have a flush. So those are the three things. To start with the Lumason, you have this package here. We're just going to open it up. And within the package, there are three component parts. One of them is going to be our saline. So this one here actually comes with a little end piece that needs to be twisted on. So we're going to just twist that on. So this is the first component part of it. The second is going to be this spike piece, and the third is going to be the actual powder itself. And so I'm just going to open up the spike piece right here. And when we're looking at the saline here, it's got this little protective portion over here that can just come right off. And so we're going to take that part off. That part goes into the green part up here, and we're just going to turn it clockwise in there. And that keeps it safe right there. And then we're going to connect the fluid with this powder here. This powder also has this blue protective cover on it. And so we're just going to take that off. And then this just goes right in here where that spike is. It just goes in here, and you can just push it with your thumb. You've got two finger supports right here, and you just push it right in. And now you can see that the fluid is now connected with the powder. And so at this point, we're just going to put the fluid in the powder just by squeezing it down. And at this point, you gently agitate the fluid to get the powder out. You can actually see at the bottom right here, there's still powder, even though we've been shaking for a little bit, there's still powder here. And so generally I like to just gently shake it until the powder goes away. And so that usually takes about 15 seconds or so. And so now you can see most of the powder is gone. Shake for a little bit longer. And then eventually what you end up getting is this kind of milky fluid right here. At this point, what we want to do is draw it back into the syringe. And I've learned this from experience. You have to be careful when you're pulling back, not to pull back all the way, because if you pull back all the way, the plunger ends up coming out and so does the fluid. So just pull it back till it's about 5 milliliters. That's about how much is in this container, so about the 5 milliliter mark, and then we take it off here. At this point here, we're going to take the three-way stopcock, and as well as the saline, and we're going to connect it up. Now it's important for the bubbles in for contrast enhanced ultrasound, when you're doing it, if it makes turns in tubing or within the three-way stopcock, it's going to actually cause some of the bubbles to burst. And so what you want to do is put it in so that it goes straight through to the IV. So the kind of complex part of the three-way stopcock is the part that goes into the IV. So therefore the Lumason would go into the part that just goes 180 degrees to the IV itself. And then at the 90-degree mark is where we put our saline flush. And so we're just going to put that right here. And we're going to open this one up. This points towards the area that's blocked off, and so right now we're just going to flush it with some saline, and then now we can move it over so that now the contrast, the Lumason, is able to come out, and we can see that it comes out as a little bit of a milky substance. And so at this point we're able to attach it up to the IV, and then we're able to inject. Usually for the first injection you use about half of this. It's about 2.4 milliliters, and then we flip the stopcock over and then flush it with about half of the amount of saline. So that's how you do a contrast enhanced ultrasound with Lumason.